This is one of the most critical questions that we are going to discuss today, is a role of a robotic surgery in a pregnant woman. I would suggest not to offer any surgery for a pregnant woman if she does not have a sleep apnea. I would always suggest for a roll of CPAP tied over the pregnancy, deliver, get back, reduce your weight, reduce the obesity, and your sleep apnea will be taken care of, along with usage of a upper airway pressure therapy, which is called as a CPAP or a APAP therapy. APAP, automated pressure therapy, is any day better than a CPAP. But I would not like to do robotic surgery unless and until the patient who is snoring also has an AHI, but a severe AHI, and I would operate this in second trimester. There are 3 trimesters in a pregnancy: first, second, third. First and third, not to operate, provide CPAP. Second, if indicated, if there are compelling indications, please do go ahead. If the patient has got severe sleep apnea, please do offer patient surgery. Patient will do some benefit. That also I would suggest go ahead with radio frequency ablations, which are office-based procedures. Please do not embark on robotic surgery unless and until required. No surgeries in second trimester or for that matter any trimester of pregnancy unless and until indicated. There are compelling, very rare indications, half the time can be sorted out with a CPAP or APAP. I am Dr. Snehal Shah. I am a head and neck surgeon. I am a sleep apnea specialist. I do cater to pediatric and adult in all age groups, and I would take care of this. As for pregnant ladies, the role is very limited. It is after a good discussion with the patient, trying to talk the patient out of any surgery during pregnancy, sail through the pregnancy, give CPAP, and then we go ahead. CPAP has been found to be not contraindicated in pregnant ladies. However, thank you so much.